Were there any specific talks that you went to that really caught your eye or that you feel like are going to be directly applicable to your work here?
Yeah, so the said area,
Mm,
so that trial, the lidera trial,
mm,
which looked at the new SERD or duradestrin drug that we can give after surgery in patients who have hormone positive breast cancer. So now we have more than one options, and patients can choose that option if they think that they are not willing to tolerate the side effects associated with the ones that we know use.
mm.
Yeah.
Interesting. Um, I'm thinking a lot about things like personalized medicine
Hmm.
and wondering if you're having any conversations with patients or if patients have a concept of things like epigenetics or how their specific cancer kind of maybe differ. Because you did mention like two patients and maybe comparing treatment options that they're getting. Do patients understand things like epigenetics and are you kind of having conversations with them at that level of depth?
Um, Not the majority do not, I would say. Maybe a patient here and there would come up with things like that, but most of them, they don't get that deep.
Mm.
Yeah.
So when it comes to side effects, how are you kind of having the conversation of balancing kind of treatment efficacy or treatment options with side effects? What are some of the factors that are going into those conversations and guiding patients through those decisions?
Yeah. So the first thing is to know what the side effects are that they're having. And then the next thing I ask is how is it affecting them? Are they able to function normally with these side effects? And to what degree are their lives being affected? And I take it from there.
Interesting.
Hmm.
Are there any aspects of the cancer journey that you feel like patients are most commonly unprepared for that they don't ask about that you wish that they would kind of be more aware of when they first kind of like enter this process?
Yeah, so the impact on family dynamics. So that's a huge one. Relationships fall apart, children get affected, and patients lose their jobs,
Mhm.
things like that. Mm.
Interesting.
Mm.
When it comes to kind of navigating these dynamics, what are some of the tools that patients most often utilize to help them get through kind of things like changing family dynamics or even specifically like losing their jobs or things like that and changes in access to care because of financial reasons? What are some of the tools that are available, organizations or things that you normally point patients to?
Yeah, so there's a breast cancer survivorship group, an initiative where patients come together and they have these sessions where they talk with other survivors as well. And there's the counseling social work department that also helps patients to navigate this. At my institution, we do have a food bank, and patients who are actively being treated for cancer can get groceries every week from the food bank for
Mm,
free. So
interesting.
things like that. And transportation as well. We do provide transportation for patients.